If you're trying to naturally induce your labor and you're wondering if nipple stimulation is going to be the thing that does it for you, watch this video because we're going to break down what the evidence says about nipple stimulation and how you can use it to help support your labor onset and also to help support your labor progress. Hey, my name is Gina. I'm a birth doula and perinatal fitness trainer, and I have used nipple stimulation towards the end of my pregnancies to try to induce my labor unsuccessfully, but I did find it really helpful during my labor to help make my contractions a little bit stronger.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I have also tried nipple stimulation to induce my labor. It did not work. And I have seen patients use nipple stimulation during labor to either help with their induction or augment to make their contractions stronger.
So this video is a part of our natural labor induction series where we discuss different things and the different myths that are involved with what will start your labor. We've discussed whether or not eating dates will start your labor. We've discussed raspberry leaf tea. We've talked about movement, like how aggressive should you bounce on your ball to get your labor going. We're going to talk about what foods you should eat, like does spicy food induce labor? No. But in this video, we're going to break down nipple stimulation and whether or not it can induce your labor or help your labor progress. And so first, let's discuss what does the evidence even say about nipple stimulation and why does nipple stimulation even work? So first, nipple stimulation is going to work because it helps to release oxytocin. And so when we are kind of stimulating the nipples by either kind of tugging on them, when your baby is breastfeeding, when you're breast pumping, it can help to release oxytocin. And oxytocin is one of the two main hormones involved in labor. And so oxytocin is released from your brain and it triggers your uterus to contract. The contraction from your uterus then pushes baby down onto your cervix, which helps to stimulate the release of prostaglandins, which helps to soften your cervix and then triggers the brain to release more oxytocin. And then we enter into this positive feedback cycle. So the thought is if we can release more oxytocin with nipple stimulation during pregnancy, particularly towards the end of pregnancy, this can help to trigger this feedback loop to get your labor to start.
Based off of the evidence, nipple stimulation potentially could help induce labor. When people started doing both nipple stimulation as well as breast massage, evidence showed that when they did that nipple stimulation and breast massage, labor came within the next 3 to 4 days for a majority of the people. And if they didn't go into labor, it changed their Bishop score. So the Bishop score is a score that we give you based off of your cervical dilation, the effacement, the position of your cervix, as well as where baby is within the pelvis. And based off of that, you get a score on up to 12. If your Bishop score is greater than 6, this is highly likely that either labor is going to start, or if you are being induced, that you have a high likelihood of having a vaginal birth with your induction. So having a larger Bishop score is a good thing. So based on this study, people did the breast massage and nipple stimulation, and they had a higher Bishop score, which means that something is happening to the cervix to cause it to thin out, soften, as well as open a little bit with that breast massage from the oxytocin release that we're having in our body.
Another study looked at nipple stimulation using a breast pump over a period of days, and they found that after 3 to 4 days, the level of oxytocin in someone was higher if they had been doing the breast pumping towards the end of their pregnancy. And so typically, if you're trying to use nipple stimulation to induce your labor, one time is probably not going to do it. It's kind of like a cumulative effort of multiple days in a row. So if you are I'm going to be induced this weekend, it's a Monday, you could try to do breast pumping or nipple stimulation throughout the week to see if that one improves your Bishop score, but two, maybe could induce your labor.
Maybe. So there are two main ways that we can do nipple stimulation to kind of help increase the amount of oxytocin we're having in our body. The one way is just with our hands. It's the easiest one. It's a little with the hands, though. It can be very taxing and tiring on your hands. But one, you're going to be also incorporating breast massage into this because not just the nipple stimulation increases the oxytocin, but also the actual breast massage can be really beneficial. With the nipple stimulation, you're going to bring your hands onto opposite sides of the nipple. So like 3 and 9, 6 and 12, like whatever the opposite sides of the clock are. You just place it on both sides. First, you're going to push back and then pull forward. Once you get to the nipple, though, this is when you're going to like twist the nipple. So it's like you're twisting it with your fingers, and then you just kind of keep doing that. You can do it. Your partner can do it, kind of whoever feels comfortable, because it can, again, be very tiring after a couple, like 1 or 2 minutes almost, can be very tiring. You can do both breaths at the same time, or you can do one at a time, whichever one kind of resonates with you. We have 2 hands for a reason, I guess. With the nipple stimulation and breast massage, you want to try to aim for like 15 minutes, but like 5 or 10 minutes is also fine. Any bit kind of helps. But if you want to go for the max, usually about 15 minutes of each breast is what we're trying to aim for. And again, you want to try to do this either multiple times in a day or multiple days in a row to see the maximum effects.
Another option is to use a breast pump, which I find to be a lot easier to do. It's easier to like do for a longer period of time, but I would say max like 2 hours, just because your nipple's going to get sore. You don't want sore nipples for a newborn baby who's trying to figure out breastfeeding. And so with the breast pump, you'll just place one breast pump on one boob, and then you'll pump for about 10 to 15 minutes. And then you'll switch to the other side for 10 to 15 minutes. And you'll just kind of alternate between the two for about 2 hours. If you're in a hospital and you're getting induced, or like you're trying to augment your labor to help increase the strength of your contractions, they may have a specific protocol that they recommend to you as well. Some of them will be like do 15 minutes and then take a break for 15 minutes and alternate. So if you are in your hospital or your birth location, just speaking with your provider about what their recommendations are specifically for breast pumping can be also really helpful. As a doula, I typically find that the nipple stimulation and breast pumping tends to help when someone's already kind of in labor, like something has initiated the labor process, but maybe it hasn't like quite continued into active labor yet. Usually if their water broke and like they don't have any contractions yet, is usually like the key one where like nipple stimulation I find to be like super helpful. And so for my clients whose water have broken and maybe they're already at their hospital or maybe they're still at home, they'll do some breast pumping at home for about 2 hours to kind of see, does that kind of increase the strength of their contractions or bring them on? And then usually at that point, if it's going to work, it has worked. If it hasn't, then at that point, if they're still at home, usually it's like, this might be time to head to our birth location to consider like more of a medical induction at that point. Because likely, I don't usually find that the breast pumping helps beyond like that initial 2 hours if it doesn't seem like it's starting anything. When you're doing breast pumping to try to either bring on your labor onset or like augment your labor if like the labor process has started but maybe isn't quite continuing, you want to be in like a little labor cave. Like you want to set the environment to really stimulate the oxytocin release as well. And so if you think about like a spa like environment or like an environment that you would go to sleep in, this is like what you want to set up for like your labor vibe when you're doing nipple stimulation or breast pumping. So have dim lights, so like the lighting isn't super bright, like really soft voices, like not a whole ton of conversation happening at this point, like watching like Law and Order on TV, maybe not the labor vibe that we're looking for. Play like really soft music or like spa music or music that you find relaxing. If there's like an oil or scent that you really like, diffuse it into the space. Just like really set the vibe so that you can just kind of focus and like allow labor to begin. And so this was something that I did during my most recent birth where I was just in early labor for like what felt like a really long time for a third baby. And so I started doing some breast pumping to help kind of bring my contractions a little bit closer. They were probably already on their way to being closer, but it gave me something to do and it helped me feel like I was in control still. But I like went in the shower. We had all the lights off. I had some like twinkly lights around like the edge of the shower. Like not in the water, but like outside. And like my husband was playing like my birth playlist and he was just kind of like sitting there like helping to time my contractions. And it just really allowed me to kind of welcome the experience and allow things to start to pick up. And eventually I didn't really need to use the pump anymore because I was having contractions every 2 to 3 minutes. But I was already kind of in labor when this helped. Like I didn't really try nipple stimulation during my pregnancy of this last birth, but the previous 2 I did, and I did not go into labor with either. I mean, I did eventually, but not after the nipple stimulation. But I found it to be really helpful during labor for me and typically for my clients as well.
From my experience with the nipple stimulation, if you're coming in for an induction, because that's usually most people that I see, I don't really see like nipple stimulation when they're already in labor. Most people are being induced, and they, before going straight to Pitocin, they want to try out some nipple stimulation to see if that would help. Or they're already on Pitocin and maybe they're at that max dose already. And they're like, we could either try something else, but like the Pitocin's not really happening. So maybe we can try and add in some nipple stimulation. Some providers don't like to go to nipple stimulation because they can't control your body. They can't control how much oxytocin you're actually going to release along with the Pitocin that we're already giving you. So I commonly do see when they are using nipple stimulation that your body will have like a bunch of contractions in a row. And usually it's not an issue. The babies can tolerate like 3-4 contractions in a row a couple times throughout the labor. And when that happens, though, there's usually a shift. So the few times where they were on max Pitocin, and I was like, you can try maybe some nipple stimulation to maybe see if that will help just like push you over the edge. And all of those times they had like 3 or 4 contractions in a row. Baby tolerated it just fine. But then I would go into the room like a couple minutes afterwards because their baby, again, is tolerating it. I don't need to go, intervene. But I'll just peek my head in, and then things definitely have shifted in their labor. If they did not have an epidural yet, they're starting to be more, like a lot more vocal. And the one that I can remember just off the top of my head, she had a baby within an hour, and she was like not contracting at all. They did a little bit of nipple stimulation, and her baby was born within an hour. Do I think it was a nipple stim? Probably. But there was a bunch of other things happening at the same time. The other ones, they either had an epidural and then they started feeling pressure within a couple of hours because it was the little bit of oxytocin that they needed to kind of push them into transition and out of active labor, which I find to be very beneficial. I personally did do some nipple stimulation with my first pregnancy, not really the other two, like with like pumping or like just nipple stimulation by itself. I did pump the night before I ended up going into labor with Lily, but I was also like taking a bath, relaxing, because I was like mentally spiraling that my pelvis was going to break in half during labor. And my friends like, just take a nice bath, turn the lights off, maybe do some nipple stim to make you feel better. And I went to bed feeling way more relaxed, and then woke up in the middle of the night in labor, and I was like, yeah, I did it.
Maybe it worked.
But maybe it was the nipple stim that pushed me over the edge.
You never know.
You'll never know. Or it was all of the other things that I did.
So in conclusion, does nipple stimulation help to induce your labor? Maybe. It could help to increase your oxytocin levels, which may trigger that labor feedback loop. But if your body is not ready to go into labor, it's probably not going to work. It might just be like that last little thing that you needed to like get you over the hump, but you were probably going to go into labor in the next day or so. I usually find that nipple stimulation is more beneficial when you're in labor and we're trying to increase the strength of your contractions. Maybe they've spaced out a little bit, or maybe you're being induced and you're trying to minimize the amount of Pitocin that you're using. Nipple stimulation can be a great option for that. You can either do nipple stimulation with your hands, where you press onto the breast and then kind of twist the nipple at the end, or I find that using a breast pump is a little bit easier. If you're in a hospital, they typically have breast pumps available, so you don't have to bring your own if you're going in for an induction or when you're going into labor. They usually have one available for you if you decide during your labor that you want to try that. Typically, the protocol is like 10 to 15 minutes per side, up to 2 hours, mostly because we don't want to be sore when our newborn babies are born. But your provider may have a specific protocol that they recommend based on your individual situation. So if you are in labor, definitely consult with your provider on what they recommend that you try to do with nipple stimulation. If you want to check out the other things that may or may not induce your labor, definitely check out our labor induction series. We're publishing a new video every week with all the different old wives' tales that folks say, if you do this, your labor will be induced and you'll meet your baby. Ultimately, a baby's going to come when they're ready, but if you're feeling a little bit more anxious or you're trying to avoid a medical induction, exploring these options are usually not harmful. If you want more support throughout your pregnancy and you're wanting to stay pregnant for a little bit longer, you don't want to use these induction methods quite yet, check out our online prenatal fitness programs. Our online prenatal fitness programs are designed to help support you throughout your pregnancy so you can stay strong, pain-free, and also to help you prepare for birth. The good thing about our prenatal fitness programs is they sync to where you are during your pregnancy. So if you join our app-based programs, it syncs to your current week of pregnancy. So if you're like 30 weeks right now and you're listening to this video, you can join our program at 30 weeks and just pay for what you use. You don't need to buy the whole thing. Our on-demand programs sync to your trimester. So we have a first, second, and third trimester option, both for fitness and for yoga. And you can check out all of our prenatal fitness options on our website.
And if you're looking for a childbirth education course because you're preparing for labor, check out our online childbirth education course where we discuss the science of labor and birth so you can understand what's actually happening within your body to take away some of that mystery and make it less scary. We also discuss induction methods. So if you're preparing for medical induction, what induction methods will your provider recommend, as well as a little bit of information about maybe other natural labor induction methods that you can utilize. And you can check out all of our offerings on our website at mamastayfit.com and use code YouTube10 to get 10% off. You could also bundle these all together to get an additional 15% with the 10 basically free.
So thanks so much for watching this video. If you enjoyed it, be sure to check out the other videos in our natural induction series. Subscribe to our channel. Let us know in the comments below if you tried nipple stimulation and whether or not it worked for you.